When I wake, I know you are with me. In the dark, I can almost see you clearly. Every day.
Laurie Marbas, MD, MDA, is a double board certified family medicine and lifestyle medicine physician who has been utilizing food as medicine since 2012. She currently holds 50 state medical licenses plus DC across the United States. She has a small concierge practice and accepts new patients at drmarbas.com. She is co-founder of the Healing Kitchen with Brittany Jaroudi, where a chef and doctor come together in the kitchen to provide a recipe of health. She is a former co-founder of Mora Medical and Plant-Based Telehealth. She was the first managing editor for the International Journal of Disease Reversal and Prevention. She is also the host of the Dr. Marbas podcast, whose mission is to provide resources that will empower individuals with the knowledge, mindset, inspiration to successfully adopt lifestyle interventions and achieve health and well-being. Dr. Marbas received her dual degrees, MD and MBA, from Texas Tech University Health Science School of Medicine and the School of Business. As a United States Air Force veteran, she served in the Middle East and South America. She is a wife, mom of 3 grown children, author, speaker, and an avid runner. Please help me welcome Dr. Marbas.
Thank you very much. That was very kind. Wonderful. So I guess we'll get started. So thank you for having me. I'm going to share a little backstory as we get going here, but this is our new book, by the way, with Brittany, Jaroudi, and I know that you guys have been shared that, so that's what that is here in the background, Plant-Based 101. So, are you thriving? Annual labs for plant-based eaters. So, as you said, I'm Dr. Laurie Marbas, and thank you for having me. I'm super excited to be here. I am a, double board certified in family lifestyle medicine, and I really have spent a lot of my career helping thousands of people who eat a plant-based diet. And as mentioned, I am licensed in 50 states, and that was part of my joy of starting plant-based telehealth and just learning so much there. And like many doctors, I was trained to prescribe and send patients on their way. And for years, I did exactly that, right? But deep down, I knew there was something wasn't quite right. Patients weren't getting better. They were kind of just managing their conditions. They kind of stuck in a cycle of medications and frustration. But then there was one day that everything changed, and a single patient's experience cracked open my entire understanding of health. And it set me on a path I really never expected. I got here. And it's a path that I changed the way I practice medicine and transform my own life in the process. But I kind of want to take you just very briefly back to kind of where it all started. So I'd like you to meet 10-year-old Laurie. And so this was me at 10. I would played on the Pee Wee team. We won that year, by the way. I was the only girl on the baseball team. And I always knew I wanted to be a doctor, right? That decision hit me like a lightning bolt when I was just 10, sitting in a hospital waiting room. My little sister, who was just 4 at the time, was always sick, right? Fevers, crying, no energy. But then she had surgery and suddenly she transformed. She went from sickly to thriving. And I knew at that moment I wanted to help people feel that kind of transformation. But as I grew up, I realized the path to becoming a doctor was not going to be easy. I grew up in a home where Money was tight, food was actually scarce, and no one graduated from college, let alone medical school. But I worked really hard, climbed over all the obstacles, going to medical school with three little kids. But I really wanted to be a doctor who made people feel seen, cared for, and truly healed. So when I finally reached that dream of becoming a doctor and went through residency, patients would come into my office and I was like, finally, I'm going to be able to do everything that I know I can do. They were desperate for solutions, right? I did everything I was told to do. I prescribed medications, ran tests, followed protocols, but deep down still, I knew something was wrong, right? I felt like that I wasn't really truly helping them and people weren't getting better. They were just managing their symptoms and oftentimes they were getting worse. But then one day, a patient changed everything. She casually mentioned that meat and dairy upset her stomach. So I suggested she stop eating them. This was back in 2012. And she came back a month later glowing, right? Her digestion improved, her energy skyrocketed, and her teenage daughter, who had supported her by eating the same way, said she felt so good. She even stopped two ADD or attention deficit disorder medications. And I was literally stunned because something, as simple as food had this much power. In that moment, it really cracked open something inside of me and I started researching, right? I love to learn. So I found the China City. I devoured it in 2 days and suddenly everything I knew about health had shifted, right? The idea of food, the whole plant-based foods could not only prevent but reverse chronic disease made so much sense. So I went plant-based overnight. So did my husband. So did my three teenagers. Yes, three teenagers, 13, 15, and 18 at the time. And I started sharing this with patients and I was so excited, right? I saw the transformations I had only dreamed before. For example, one patient, she's a type 2 diabetic on 60 units of insulin, called me just 3 days after starting this way of eating. She was shaky, not feeling well, and we had to adjust her insulin to where she no longer needed it. So 60 units of insulin gone in 72 hours. Wow, I was amazed. I learned very quickly there were things that I needed to do and be responsible when I was sharing this with patients, right? Because it wasn't all smooth sailing. At first, I thought it would simply telling people to eat plants would solve everything. But I quickly realized that many plant patients were coming back feeling a little frustrated, hungry, or tired, right? They were only eating fruits and vegetables. They not realizing their body needed those whole grains and legumes because I said go eat plants. I didn't say all the plants, right? So I discovered that no two patients were the same. Some needed supplements, others needed more specific labs to fine tune their approach because maybe they were on medications, they weren't observing things well. And many needed understanding the habits that were holding them back. So, because I have worked with thousands of plant based patients, I literally do trial and error and thousands of data points. I have learned to hone in on the specific problems that hold people back. And so that's when I really realized that healing isn't just about the food on your plate. It's about understanding your body, your data, and your habits. And that really allowed me to understand what I needed to do. So I started creating information. And I've seen this process work over and over. Patients who reverse type 2 diabetes, people who finally lost weight and kept it off without counting calories, women who regained energy and felt alive. So that is when and how this presentation came about because I was like, I need to do more. I need to educate people on what this is. So it's more than a presentation on labs. This is really about how to understand your own body and not feel like it's a simple solution because we are all different. We enter into the plant-based space at different stages of our lives and going through different things. So that was the story of 10-year-old Laurie, but now 54-year-old Laurie is going to move on and tell you why do you need to check your labs annually, right? So a few different things to think about. Rule out possibility of nutritional deficiencies. I've had patients who come in not taking B12 supplements, and I'll share some of these stories as we go along so that you can understand why I'm pointing out the ones that I do. Maybe we tweak an already excellent diet. I mean, I do get a handful and actually quite a few of the worried well. They're doing fabulous, and we don't have to tweak any, but sometimes we tweak just a little bit. Maybe they need to up their B12 just a little bit. We evaluate symptoms. Sometimes people get really frustrated when they switch to a plant-based diet and their guts all bloated and they don't understand how you just need to ease into a lot of fiber because you were probably fiber deficient before. And so that is another thing here. And then ongoing record of results to use if things do change, right? So if you have these records and this data, you can go back and say, everything was okay until this point. That helps us to be the detective in what's going on. And that's just a good way to approach medicine in general, is understand what's the data pointing to, and then add data for a holistic approach to health. So I always encourage patients, don't get emotionally attached to data. Numbers will change. You tweak a little thing. It's like tuning in to a radio station. You really want to feel thriving. That's what we're doing here. We're going to learn how to tune in, and that's what we're going to jump into next. So we're going to go over a few different type of tests. First of all, you have the basic annual test for everyone, regardless of diet. These are things like your complete blood count. We're going to go into each of these shortly. A comprehensive metabolic panel, a lipid panel, highly sensitive CRP, LP little a, and ApoB. I'll be going over all these shortly. Thyroid panel, which includes a TSH as a thyroid stimulating hormone and a free T4. And then your hemoglobin A1C, which tells us the stickiness of red blood cells, which is important for diagnosis of things like diabetes. Then we're going to talk a little bit more in depth about the specific concerns around for plant-based eaters, right? We're going to talk about B12, vitamin D, omega-3, iron and ferritin, calcium, iodine, zinc, selenium, magnesium, protein, homocysteine, methanoic acid, and folate. A lot of these can kind of be lumped together, and I'll explain as we dive deeper. It's not that you can't get these except for B12 on the whole plant-based diet. I just want you to pay attention. There are some things that may point to a few things if you walk into a plant-based diet at a different stage of your life, what we need to pay attention to. So that's kind of what we're going to cover. And like I said, I'm going to highlight a few stories of how I learned over many years of working with patients why this needed to be addressed and why this needed to be paid attention, and how I would start, making a list of things that I created a template to use with plant-based patients, and has been very, very fruitful by doing that. And we just kind of get to the point very quickly. All right, so let's talk about your complete blood count with a differential. So this is going to highlight a few different things. It's going to talk about your red blood cells, right? This is how much your bones are producing the red blood cells. Your hemoglobin and hematocrit will tell me if you are anemic or if your blood count is okay. White blood cells. Now, this is really an interesting thing that is not uncommon to see lower than normal in plant-based diet eaters. And why this is so there's some things what we call they're acute inflammation markers, right? So when someone, let's say, has an injury, you might see inflammation, right? So let's say you twist your ankle and you see swelling and redness and it's hot, or you see an infection, right, or a bug but I bite you. That's a normal response. That is called inflammation. This is acute inflammation, and that's not a proper response by the body, because we want the body to be able to heal itself, because it's kind of like a call to arms, like, hey, immune system, let's get over here and start healing. Things start happening. The body's a remarkable healing machine if we give it the right inputs. But then we have things like chronic inflammation. So we understand in the United States, especially now, that many people are overweight, chronically inflamed. Most people, not less, are on one or more medications. And unfortunately, this leads to a chronic state of inflammation. And I know you guys have heard of that before. But what will happen is people who eat a standard American diet, or they have some type of illness or inflammation that's chronic, like chronic disease like type 2 diabetes, autoimmune disease, heart disease, all these different things, you'll see the white blood cells go up, right? So when someone who is very healthy, eating a very anti-inflammatory diet, which is a whole food plant-based diet, these white blood cells will drop below the typical 4 to 4.5 range. And sometimes I'll see them around 2.5, as long as I don't see what we describe as the white count differential, where you might see some people will get an order and it will say, oh, you have neutrophils and you have lymphocytes and the different types of white blood cells. As long as those look okay, someone's not, and they're feeling good energy, they're not having recurring infections or anything, I think as long as we hit around that 2.5 mark and you're and above, you're probably okay. Another thing to consider here is that if someone is morbidly obese, you might see that they have really high white blood cells. So maybe they hit in around the range of 13 to 16 and every single one. And they'll tell you they feel okay, but their body is reflecting back in this test that there's inflammation and it's chronic. So this is really important. White blood cells, again, like acute phase reactants is the proper name to think of in that state. And platelets will do the same thing. So platelets are important for basically think about coagulation. So if you cut your hand, the platelets come in and they start causing a clot. Now platelets are also interesting because when you have a heart attack, let's say, you hear about the plaque within the heart arteries and you see there's what we describe as junior plaque, or soft plaque, and it will rupture and cause almost like basically a scratch on your skin, and you'll see the platelets come, they create a clot, and then it shoots downstream, and that will cause the heart attack or the stroke. So platelets, again, are one of those acute phase reactants. Then we talk about these are the mean corpuscular volume. This is a really interesting thing. So let's say that someone is not anemic, and when I refer to not anemic, their hemoglobin and hematocrit are normal. I really want to highlight three different types of anemia. So you have, excuse me, you have microcytic anemia, which is going to tell you that the cells are small, right? There's a problem with the iron. We're losing blood somewhere. Typically, you have your normocytic anemia. So this is going to be someone who probably has some type of chronic disease. Let's say their kidneys aren't spitting out the hormone that tells the bones to make red blood cells. Or this is someone who just had trauma and lost a lot of blood very quickly. Then you also, like, for example, maybe a pregnant woman and she hemorrhaged during delivery or something like that. The other one is called macrocytic anemia. And this is one I'd like to highlight. This is when the red blood cells are very large. And this is usually a problem with folate or B12. Okay. So that's why I want to mention this MCV, or mean corpuscular volume. And sometimes you may see someone whose hemoglobin and hematocrit is normal and their MCV is large. And you're like, huh. And if they're eating a whole food plant-based diet, they're probably or potentially maybe not getting enough B12 because their red blood cells are reflecting this in their labs. So that could be someone just outside of, normal 101, 102, something like that. You up their B12 and amazingly, their red blood cells get back to where they need to be. So I wanted to highlight that. The mean corpuscular hemoglobin and the hemoglobin concentration, these are just more referring to the iron concentration. All right, moving on. This is one that you probably have had lots, the comprehensive metabolic panel. So glucose, again, is your blood sugar. I do recommend getting your labs in a fasted state. When you go in to get labs and they're not fasted, it's a little bit harder because it'll be based on what you ate, and how much you ate, what time you ate, were you dehydrated. So I like to keep all things the same, especially when I'm going to decide treatments and are we changing things. So I do recommend that people do a fasted state when they do their blood work, unless their doctor tells them otherwise. But that's what I typically refer to my patients. Okay, so glucose, when we think about glucose, we'd ideally like to see it probably under 90 for most insulin sensitive individuals, meaning that they can utilize the hormone produced by the pancreas to bring blood sugar into the cells and create energy. There's lots that I could talk about. I could talk about glucose and insulin resistance for an hour by itself, but I just wanted to highlight that if you start seeing a trend upward in your glucose, for example, it was 85 5 years ago, and then 2 years later it was 89, and then it hit 96, and now it's 102. This is telling us that your body is not able to utilize, insulin very well. You're becoming more insulin resistant. Something is occurring. Next is calcium. This is very rarely an issue because your body is wanting to keep a tight control on calcium. If your calcium's too high or too low, there's usually some type of problem with the regulatory system. And so I really want to highlight that because, again, that could be a parathyroid issue that helps regulate. It could be a vitamin D deficiency. It could be a whole host of things that could be going on here. Now, the albumin, total protein, and another test that's outside of this would be pre-albumin, would tell us about your protein status. And some individuals could be a problem if, let's say, why I say you can absolutely get plenty of protein on a plant-based diet. However, when I have, let's say, my older little ladies that come to see me, not uncommon, let's say they're 72, 75, and they start eating this plant-based diet and they heard some guru say, you needed a pound of vegetables every day for breakfast. Okay, Well, if I'm dealing with someone who has a capacity of their stomach, it's not very big, and they go and try to eat a pound of vegetables, and there's so much fiber, they're not going to be very hungry later in the day to eat those legumes and those whole grains and those nuts and seeds that bring in enough protein to offset things like sarcopenia or muscle loss that occurs with older age. Protein's important also for wound healing. So many things important for to make sure that you're paying attention to what's on the plate. And again, this presentation is actually evolving into another one that I'm creating currently that not only talks about the labs, but also speaks to the need of how to look at your plate, what is ideal to make sure you're getting everything, when do you know you need supplements, all things. So I go deeper into that presentation. It's not quite ready yet, but definitely it's on the horizon very, very soon. But I wanted to highlight the need to pay attention to protein, especially as we get older. And I would tell people to shoot for 1 gram per kilogram of body weight, of ideal body weight. So what that means is you have 1 gram for every 2.2 pounds of your ideal body weight. I tell people your ideal body weight, if you're overweight, is probably somewhere under 22 BMI. That's just a starting point. Now, because I say that based on my own clinical um, experience, is that when people, let's say, are struggling to become insulin sensitive, they're struggling to get that hypertension down. Most of the time, if I can get them in that BMI status of, less than 22 in a healthy state, they're exercising, all those things, what we'll see is many of those problems will resolve. So that's just where I'm just saying for my clinical experience, but absolutely everyone thing can change. When I was in the Air Force, I would have strapping young men whose BMIs were 20, 26. There's not an ounce of fat on them. They were just very muscly. So, but for the most part, this is not the population that I'm dealing with, but I just wanted to highlight that with you. Next, we're talking about your electrolytes, your sodium, your potassium, bicarb chloride. Most of the time, these are fine. Again, there is some indications if you have low sodium, there's something else going on. It's not the diet. If you can eat plenty of potassium on this, the plants, there's plenty here. Again, these are going to be more highlighted if there's some type of metabolic issue. And this is not the appropriate place here to go through that. Now, BUN and creatinine, these are going to be leading towards, how is your kidney function? Really important here that I want to highlight. With a whole food plant-based diet, you're going to be eating a lot more potassium. So if you have been told that you have chronic, kidney disease or CKD stage 3 and above, it's really important that you speak to your kidney doctor or your nephrologist because at certain stages of disease progression, the kidney struggles to actually manage potassium levels. So this is where it's important that you say, "Hey, doc, I'm going to be eating more healthy vegetables. Might be increasing my potassium. Will you help me to make sure that I'm doing this appropriately?" And as long as you just slowly start bring in more of those healthy plant foods, for the most part, and you keep in touch with your doctor and you start doing blood tests probably about every 7 days to pay attention to your creatinine, pay attention to your potassium, you're probably going to be okay. And what you see is that many times the inflammation, remember we talked about that earlier, will start decreasing and you'll see the creatinine start to trend downward in people with chronic kidney disease. Now, they may not get to the point where it's back to complete normal. And what that is, that's probably there's some scarring that's occurred in the kidneys, and you will not be able to reverse that. But you can decrease the inflammation, and that's where you'll start seeing that decline. And then the next is your liver enzyme. So this is like your ALT, AST, alkaline phosphatase, although that can also be indicative of bone health. The liver enzymes, if you have fatty liver, you may have normal level of enzymes. However, if you start seeing trends upward in your liver enzymes, now we're moving into an even more concerning area. So this is where the liver is like really struggling. And that can set you up for fibrosis and other things. And so cirrhosis and liver failure. So really pay attention to this. It's not an uncommon diagnosis these days of what they previously called, non-alcoholic fatty liver. Now it's basically related to metabolic syndrome. So you may hear them call it something else. And that is really important to highlight there. You'll see liver enzymes improve. And a really great case of this is when I had gone plant-based and probably for 3 or 4 years in, I had a parent bring me in their 12-year-old child. And she had been told that she had elevated liver enzymes. They had, she had been seen by a PA and then referred to me as a physician to follow up. And I started talking to him about eating a healthy diet. So she was slightly overweight. Her liver enzymes were slightly elevated. Any imaging that we had should show that she had fatty liver. And here's a 12-year-old kid, basically based on, these parents were struggling to, one, have enough money to feed their children well. So we talked about how to approach a plant-based diet in a budget-friendly way and actually save money, but also, heal their daughter. But following the guidelines, I also recommended they see the GI specialist or the gastrointestinal doctor, the specialist of the liver. And so in the interim, they engaged in eating this whole food plant-based diet, which was remarkable. They went to see the GI specialist. The GI specialist said, well, there's not a whole lot we can do, pretty much brushed them off and sent them back to me with no comprehensive plan from a specialist point of view. I was like, that's okay. We're taking matters into our own hands. And over the next 3 to 4 months, she lost around 5 to 10 pounds and had more energy. She joined a little club of a girls running club, and her liver enzymes came back to normal. Within 4 months, her fatty liver had completely resolved. So we take this child from heading down the path of metabolic disease, which would have been early type 2 diabetes, probably infertility, PCOS, increased risk of heart attack, stroke, cancers, all of these different things. And we put her on a path to health. But it not only helped her, but it helped her little sisters. It helped her parents understand the value of nutrition and that they alone are responsible for what goes in their children's mouth. And there's always a solution, to be solution oriented. So I just want to highlight that story because that is one thing to understand, that the plant-based diet is absolutely one of the most powerful things you can prescribe. But again, sometimes you need to be a little careful about different things. So hence why I mentioned what I do. All right, moving on to the lipid panel. I get a lot of questions about this. Holy moly. So a lot of times people will move over to a whole food plant-based diet because their cholesterol is high, their doctor wants to start them on a statin or various reasons. So I'm just going to highlight a few things that I pay attention to. So you have your total cholesterol. You definitely want to see that as low as possible, preferably under 150. But I'm less concerned about your total cholesterol. I'm more concerned about your LDL, which is your bad cholesterol, and your ApoB, which is on different types of cholesterol. So if you think about your cholesterol, it's just a transport of cholesterol and triglycerides. And I have an entire workshop on cholesterol, so I'm not going to go deep diving in this here, but basically, when you start seeing over a longer period of time your LDL above 100 for, let's say, a lifetime, what you will see here is an increased risk for cardiovascular disease. And if you follow Dr. Axelson's work, I'm sure you're familiar with the story of young men who had been killed during the Korean War and they came back with autopsies. So these are men in their later teens and early 20s. When they did the autopsies, they had extensive cardiovascular disease or heart disease with plaque in the arteries. So this starts at a very young age. You can start seeing, fatty, basically little fatty strips being laid down in the arteries around the age of 10 in American children. And that is very, very concerning. And especially now, we're in this kind of weird flux where, kids like in my generation, so I grew up in the 70s and 80s, we didn't have, we started having more of the ultra processed foods, I'd say even in probably the 60s, but many times, families were still probably cooking a lot of their own meals. But now we're raising children in a plethora of ultra processed foods, and that's where the majority of their food comes from. They're probably even at higher risk at an earlier age. And it wouldn't surprise me if we start seeing things happening while the mother's pregnant with children at some point in the future. But the other piece here is your HDL. This is your healthy cholesterol. It grabs the bad cholesterol and lowers it. So sometimes when you transition to a plant-based diet, what you will see is your LDL will drop and so will your HDL. Now, when your HDL drops, it's because typically think of it as a garbage truck, right? And your LDL is the garbage. And so if you have less garbage, you need less garbage trucks. So it's a kind of a, demand, right? Supply and demand situation. If you want to, apply an economics course on this. And then you have triglycerides. These are the fats in your blood. So things that will increase this are going to be high, what we call very like high floury foods or highly processed, ultra processed sugary foods like donuts and cakes, certain breads. So if you do eat bread, which is fine, I would do some type of sprouted grain bread or like a whole wheat bread. Make sure you're eating that with lots of vegetables and of course and things like that. That's where you'll see triglycerides up. And on occasion, you may see someone who is embracing a beautiful whole food plant-based diet, but they have a significant amount of weight to lose, you'll see a transient elevation of triglycerides. And because the fat cells are basically breaking down, and you'll see that release, and that should improve. When someone has rapid weight loss and they have a lot of weight to lose, they're also at higher risk for gallstones, right? And so, not uncommon. It doesn't matter how you lose the weight, especially if you lose it in a rapid form or fashion. It's you're at that high risk. So again, there's lots of ways of things to discuss here, but that's just something I'd highlight there. If you're eating a lot of, let's say, dried fruits and or adding a lot of, let's say, maple syrup or some type of refined, some type of sugar that raises blood sugar high, you will also see triglycerides elevated. Also with alcohol, you can see that happen. Alcohol in any amount is not healthy. So regardless of what you've heard, alcohol is not healthy. It's a poison to your body. This is the way it is. The research absolutely upholds that. And so that can be another issue too. So just something there to highlight. The HSCRP is a low-grade inflammation marker of your cardiovascular system. One thing I want to highlight is someone who's, let's say, they don't have any evidence of heart disease. They're a healthy weight. Their cholesterol, that looks good, but their HSCRP is slightly elevated. I would say start looking for other places that can't see or feel necessary inflammation, like your mouth. So if you have a lot of dental caries, or maybe you've had a root canal, and suddenly like you're told, wow, my HSCRP is elevated. What's going on here? I would go get your teeth cleaned and had them x-rays. I had a patient who had been eating a whole food plant-based diet and doing really, really well. And then lo and behold, he had started having high blood pressure, inflammation markers going up. He actually had a root canal, meaning he doesn't feel this, and it had been infected. So they removed that, took care of everything, and guess what? Everything got better. So I'm just saying your body was telling you things, so don't ignore it. Just listen in. The LP-little-a is an independent risk factor for heart disease. I really want to pay attention to this. I have a great story in this. So, a woman in her mid 70s came to see me, one of my worried well, super fit, trim, exercising, had been on a plant-based diet longer than I've been alive. And she was remarkable. And so we checked her cholesterol. Her total cholesterol was 120. Her LDL was like 60. I mean, just beautiful labs, right? But we checked her LP-little-a, it was over 600. And so this is concerning because it's what we describe as an independent genetic risk factor for heart disease, meaning that diet, lifestyle, don't budge this. There's no medications actually on the market currently. There's some, coming on the market, but they're concerned about this really high LP-little-a causing the risk. So we're both slightly alarmed, or more than slightly alarmed. And so we ordered what we call a coronary artery calcium test, which basically is a 5-minute CT scan of your heart arteries to see if there's any evidence of past or plaque in the arteries. And hers was 0, which is a perfect score. And it really highlights the need to pay attention to the things that you can control. And I really think just because of that one story, I'm projecting out that it's even more important that we really pay attention to your ApoB, your LDL. But the ApoB tells us, because ApoB sits on LP-little-a, ApoB sits on your LDL. So even if you get that LDL lower and you have evidence of heart disease, we really want that ApoB to be as low as possible, probably under 70 for most people. So then just a quick reference and discussion. And if people who eat a whole food plant-based diet are struggling to get their cholesterol lower, maybe it went down and came back up, not an uncommon scenario because I see these folks. I do have a cholesterol lowering protocol that I put them on, and it's basically really utilizing the soluble fiber foods, things like amla powder, which is any gooseberry, berberine, things like that, can really, really see that. I had a woman just this week, her whole food plant-based, her total cholesterol starting have been 206, 211. We just got her labs back after instituting this. 146 was her total cholesterol, and her LDL dropped by over 50 points as well. I was like, this is a good one. Yeah. So lots of good things you can do. This is the importance of the tweaking, paying attention, and not just ignoring it, thinking that, oh, I eat plants, this is going to take care of it. We really want to eat, make sure we're paying attention to a balanced plate, and looking at these labs, especially if you're coming in and having any prior conditions. All right, so thyroid panel, this is going to be TSH, like your thyroid stimulating hormone, your free T4. This is basically, one of the most common autoimmune diseases, especially in women in the United States. I was diagnosed with Hashimoto's, and which is hypothyroidism, after the birth of my second child 28 years ago. And when I went plant-based 13 years ago now, my thyroid over the course of a year or two got better. I still require medication, but not as much. And so that's a really fascinating thing. The other thing I'll highlight here in a minute when we get to the plant-based labs is iodine. Iodine is very important for your thyroid health. So if you eat a whole food plant-based diet, SOS free, so salt, oil, sugar free, which is fine, but you need to highlight that iodine typically comes in iodized salt in most Western countries. So they unbeknownst to them, have now eliminated their main source of iodine. And so what I would say is that probably a supplement or making sure that you're getting those sea vegetables that have iodine in them are added to your diet on a regular basis. And why I say this is that I think I've had 4 cases of this where people who transitioned to a plant-based diet 6, 7, 8 months later had labs done. TSH is now elevated because now the pituitary is responsible for releasing this thyroid stimulating hormone to tell the thyroid to, hey, spit out more T4. And if its thyroid doesn't have enough iodine as fuel to create the T4, the pituitary goes, hey, I need you to, make a little bit more. So it's like yelling, like a parent raising its voice at a child. I need you to pay attention and get busy. That's why you'll see that TSH elevated. And the moment we collect a urine iodine, and I'll explain that here in a minute, lo and behold, iodine's low, give them iodine supplement, bam, they're good. Or you can do 1/4 to 1/2 teaspoon of iodized salt daily. Again, depending on your current situation. I don't recommend necessarily everyone take up more salt, but that is an option as well. The hemoglobin A1C, again, is the stickiness of red blood cells over around 90 to 120 days because that's the lifespan of a red blood cell. And once the red blood cells start to die off, this will be a change. So typically you don't check this more often than every 3 to 4 months. And where you want this to be, most people, well, below, 5.6 and below is considered normal. 5.7 to 6.4 is pre-diabetes. 6.5 and above is considered type 2 diabetes, or maybe you have some other type 1 diabetes. There's type 1.5 diabetes. Again, that can be, the blood sugar, insulin resistance, all that's an entirely different deep dive subject. But I want you to highlight this. One very important thing that happened very recently with a patient was a couple, older couple, had transitioned to a whole food plant-based diet. Again, hearing lots of different feeds from different quote unquote gurus on what they should be doing and how they should be eating. And she was just trying to keep up with all the recommendations, right? And then she became almost fat phobic, so they didn't have nuts and seeds. They didn't want to do soy because it had too much fat. And then what about this? They were worried about this. And so before you know it, all they were eating was a lot of fruits and vegetables and had a few beans on occasion. What happened was her husband, who was just eating what he gave her, he was eating. Well, I get that. They came to me because his hemoglobin A1C went from normal to high, transitioning to a whole food plant-based diet. She sent me their food log, and it was a beautiful assortment. If you look at just the foods, these are fine. These are healthy whole food plant-based. I noticed a few things were missing, but more importantly, he was eating around 12 times a day. And so when you think about this, if you have 12 inputs of glucose into your body, your blood sugar is going to stay high all day long. And his, bless his heart, he was always hungry and tired because he wasn't eating enough calories, because they were removing out of fear some of these foods. So the more restrictive your plant-based diet becomes, the more likely you're going to run into problems. So I really want to point that out. And as we started looking over things, we put a CGM on him, a continuous glucose monitor to measure his blood sugars 24/7. We gave him up with a plan. It's just eating 3 meals a day. If he was really hungry, he'd have a snack. We talked about what that should be. And he had lost too much weight. He was still doing resistance training. We made sure he's getting enough protein in his plant-based diet. And he came back about 2 months later, A1C all better, blood sugars looking fabulous, and he had more energy and felt more confident. And they didn't change not eating a plant-based diet, they just changed how they were doing it. We alleviated those fears. They educated themselves on what that was. So that's another point here, is that if you're eating a whole food plant-based diet, your A1C is elevated. Let's go dive into what those causes could be. And there's other causes that could be that are not related to the diet. There's other things your body's saying, hey, something's going on here. So just want to you have to be a really good detective and have someone who's knowledgeable to lead you down that path. Okay, so let's talk about the B12. B12 is the one supplement, guys, that is a non-negotiable for my patient. Anywhere between 500 to 1,000 micrograms daily should be sufficient to get your blood levels above 500, not above 1,100. You want to be in that sweet spot. Now, some people may need a little less. Some people need more based on a few different things. Are you on metformin? Decreases absorption. If you're on medications that decrease your absorption of certain or decreases your acid in your stomach, you're not going to absorb B12 as well. So some things to really pay attention to. Why do I say above 500? In the labs, it'll say 250 might be your low normal, because again, and the research will uphold this, below 500, especially below 400, many times people will be having signs of deficiency. Remember that MCV might be elevated. They might feel tired. They might be feeling forgetful. They might have some tingling in the nerves. Signs of B12 deficiency. You up your B12, you're fine. Remember, B12 is made by a bacteria, not by plants, and not by animals. When we eat animals, it's, we're eating the B12 that's in their flesh. But because we come from a place of complete deficiency, because we're not eating that in our diet, unless you do it from fortified foods, but that's not a reliable source, absolutely do the supplement. But as long, if you want to go drink some water that's not been filtered and some soil and try to get your B12 that way, like our ancestors did, maybe so, but I just take a supplement. Just want to highlight that. B12 is important, guys. And vitamin D, really not something to do with plant-based diet, but it is really, really important. And so I would say the majority of people in the United States are vitamin D require some type of supplementation, or at least with fortified foods on a regular basis. I ran in Florida, lived in Florida. I ran, gosh, I would run 3 to 10 miles almost on a daily basis. Short sleeve shirts, shorts, didn't use sunscreen because I wanted to get, the sun. My vitamin D could still not hit above 27. And 30 is minimally where you want to be. Probably closer to 40 would be a little bit more ideal. And most people are going to require 2,000 international units daily. Very important for bone health and immunity. Omega-3 fatty acids, there is going to be some controversy here. There is a blood test you can check. It's called the Omega Check. I do recommend you try to get those levels above 5.5. Some people can. Majority of people might want to actually do an algae-based omega-3 fatty acid supplement. So these are going to be the 3 core supplements that I'm recommending, because this is important for brain health. It's also important for heart health. And again, you can up your ground flaxseed, you can up your chia seeds, your walnuts. Some people are fat phobic, meaning they don't eat these foods because of, again, whatever reason. Nuts and seeds are very healthy for your heart. There's zero evidence, if you actually look at the research, how nuts and seeds are very, very good for your heart health. Those who eat a couple of nuts and seeds, like a quarter cup a day, have lower risk of mortality overall. You're going to get your good, healthy fats that help you absorb your fat-soluble vitamins like A, D, and K. They're anti-inflammatory, great sources of protein. Outside of that, the omega-3s, we take the plant-based, the AOA, and just take a small amount, 5 to 10%, and convert that into the long chain, which is the DPA, the EPA, and so and the DHA. So these are the ones that I would say are important. I know we're running short on time. I'm going to keep going here. Your iron, total iron binding capacity, and I'd also mention ferritin. So women who are menstruating, this is more of an issue. It's less of an issue for postmenopausal women and men, but women who have heavy periods. So the iron and the total iron binding capacity. So iron in its non-heme form, which comes from plants, slightly harder to absorb, but you absolutely can get plenty on a plant-based diet. Just you might want to combine it with a little, vitamin C rich foods. That'll help you absorb it a little better. But I wanted to highlight if you're feeling fatigued, tired, hair loss, restless leg syndrome, these could be your culprits. And so beyond checking your iron, because the iron, remember guys, your body is always trying to stay in balance. So when you check just the iron and the total iron binding capacity, and this is telling you basically the iron is what's available for your body to use in the blood right now. Total iron binding capacity is like saying your hotel room, you have vacancies. There's also a saturation, but that is okay because if this is low, we definitely know we're probably anemic as well. But the ferritin is like the storage unit in the back. So it's the storehouse, the storage protein for iron. Now, if this is below 50, it could very well be the cause of the fatigue, the hair loss, and let's say restless leg syndrome. So we try to shoot to get that above 50, minimally above 40, but if we can get closer to 50, but sometimes it can be a little bit harder. So sometimes if you're having heavy menses or you're going through this perimenopause and women's hormones are fluctuating, they have heavy periods and light periods, they might be challenged here a little bit on the ferritin. And if you're a long distance runner, you're beating up your red blood cells, it's not uncommon to see your ferritin low here as well. So we have to pay attention. Certain activities may cause a lower ferritin. Moving on to calcium, again, important for bone health. And I only say this, it's not necessary that the lab is going to be showing a problem, because if it does, we do need to do a deeper dive that's outside of your diet, most likely. Is I would want you to pay attention to how much you're getting in your diet. And there's a little app called Chronometer. You can also do MyFitnessPal to make sure, especially women, well, and men too, of course, they were hitting that. And there is some debate on how much you should be consuming. I would say minimally 1,000 milligrams, probably ideally 1,200 milligrams per day in your diet. You can get this also from, let's say, calcium enriched plant based milks, tofu. I'm a huge fan of soy. Soy's got some amazing benefits. No, it's not going to cause cancer. It decreases risk of breast cancer, increases survivability, decreases your cholesterol, improves your bone. So many beautiful things, decreases risk of prostate cancer. So again, some things important here, but I just want to highlight the calcium. Of course, it's important for bone health. It's important for muscle contraction and such. Moving on to iodine, I talked to you about that before. The test is not a blood test, guys. The iodine, again, that's just a snapshot in time. You have to collect your urine for 24 hours. I know, it's a pain, but you go get a little special jug. You get to collect your urine. Yep, store in the fridge, I know. But the iodine, if that's low, but I would only put someone through that unless they really wanted to know, or if they were concerned about their thyroid health. That's where I would order that. And next to be zinc. Again, if people are worried about their fat phobia things, I'd say the zinc, selenium, and magnesium are going to be found in those nuts and seeds. So it's really important that, again, most women, I'd say a quarter cup a day of varied nuts and seeds. I do 2 tablespoons of pumpkin seeds daily, and all my labs are always fine. I do have seen low zinc. I have maybe 1 or 2 low selenium. I don't think I've really seen magnesium, but when we add in more magnesium rich foods or add a magnesium supplement, many times like muscle cramping, sleeping, things like that get better. Zinc is also important for your immune health and thyroid health too, and selenium as well. And protein, we talked about that already. Homocysteine and methylmalonic acid, to wrap this up, is really tied to your B12. Now, I have tested thousands of homocysteine and methylmalonic acid. Absolutely seen homocysteine above 10. The reason that is B12 is required by homocysteine and methylmalonic acid to be further metabolized. Homocysteine also requires a few other B vitamins, but really wanted to highlight this is that when homocysteine is elevated above 10, you're at a higher risk for stroke. And there was an interesting study, I believe it came from the UK, that they looked at basically ethical vegans, ethical vegetarians. They were not supplementing. They had higher stroke risk than their omnivorous cohort and people eating a standard diet. And I do believe it's because of the B12. So try to make sure that B12, if the homocysteine remains elevated, there's other things that might be going on. And I have yet to see elevated methylmalonic acid, except I think in 1 or 2 cases. So homocysteine, I'd say, is a much more sensitive test. And that is the best, but I'm going to tell you how I'd recommend optimization. 1, test, don't guess. Supplement B12 regularly, no exceptions. Consider supplementing vitamin D and algae omega-3s based on test results. Pay attention to protein, especially as you age. 1 gram per kilogram, 2 pounds of ideal body weight, which again is that BMI of 22. Eat a variety of food categories, legumes, whole grains, vegetables, fruits, nuts, and seeds, and colors of the rainbows regularly. And yes, I love that little rainbow. Moving on. Next would be pay attention to your body. If it's something, your body is telling you something, it's not something to ignore. And it doesn't mean the plant-based diet has failed you. It just means something needs to be tweaked, something needs to be looked at, something else is going on, right? The plant-based diet is amazing, but it is not a panacea. And so we have to deal with the reality of, again, people are coming into this diet at different stages and ages, different backgrounds, different genetics, things will change. A plant-based diet is absolutely the base foundation for all of humanity. But again, we are individuals, and this is where these tests come in. Discuss with your doctor any medications that could be causing malabsorption. Or maybe you are still having a lot of issues. Make sure you don't have like a gluten issue or celiac disease. That can sometimes hinder your absorption even further. Stay hydrated with water. So many times people don't realize that sometimes when they're tired or have headaches, water is an issue. And it also helps all that fiber that you're eating get pushed on through. So if you're having a little constipation, up your water content. I'd say 8 to 10 ounces of water per hour the first 10 hours that you're awake. That would be a start. Next is test your iodine if you notice a change in your thyroid levels after going plant-based. And menopause can throw a monkey wrench into your labs in life. Seek help. This happened to me a year and a half ago, doing everything right, fell off the menopause cliff. It was a wild ride. So just saying, it led me down the path to become a menopause certified practitioner. And estrogen is special. I'm just going to throw that out there. Again, that's a whole nother discussion. So understand a whole food plant-based diet is not a panacea, but as close as we can get. Okay, that is my presentation. Again, they mentioned if you want to learn more, we just renewed our website. It's all brand new, stinky new. There's going to be some other cool things coming up soon. So check it out. We have an email newsletter that we send out every week with an article and a recipe and all the special events that are coming up. So thank you.
Well, Dr. Marbas, I'm excited because I get to ask the first questions. But first of all, I want to say that the chat box has been humming. You provided so much information. I think you may have a couple of new clients, patients after this presentation. But my questions are based on B12. And I know that you covered it. You said between 500 and 1,000 micrograms or milligrams a day.
Yeah.
But the question is, if you always test higher than 1,100, can that cause an issue? And then also, as you get older, does the absorption rate of B12 is there a propensity for less absorption of B12?
Yeah, I would say after, especially around age 65, you're definitely going to see a drop off of that absorption because your body releases in your stomach a thing called intrinsic factor. And sometimes individuals might need to up it. Now, your body will take a small amount of B12, even if you have intrinsic factor deficiency, you can actually take a very large amount and your body will absorb it, what we call passive absorption. But many times those individuals, excuse me, will require injections, monthly injections. Now, if your B12 is elevated, and you are not supplementing and you're eating a plant-based diet, this absolutely needs some investigation because, again, you could have liver disease could be an issue. You could have kidney disease. You have blood disorders. There could be like leukemia, polycythemia is another one because what's happening is your body can increase B12 due to overproduction of the proteins that bind to B12. Sometimes you can have inflammatory bowel disease issues. Again, certain cancers because they can lead to excess B12. So if you're seeing that, first make sure you're not taking too much supplementation. But if it's consistently elevated, that needs further evaluation. And I'd recommend seeing a hematologist if it's not a supplementation issue.
Okay, great. Thank you so much.
One person that was asking about how long to fast before a test. And then the second part of her question was, if she ate something for supper last night that maybe was a little higher in fat than normal, will that affect the next day's testing?
I would say minimally 8 hours, probably maximally 12 hours would be an issue. Wouldn't be an issue. Make sure you're well hydrated because sometimes people don't drink enough water. So 8 to 12 hours should be more than sufficient because your body will have metabolized, everything that you consumed. Now, as far as having elevated higher fat, it really depends on how much. So things that could be affected, high fat meals can temporarily increase your triglyceride levels. Remember, those are those fats in your blood. So, but for the most part, if you are fasting 9 to 12 hours, now high fat meal can also affect your insulin resistance. So if you're someone who has been transitioning to a plant-based diet to improve, let's say type 2 diabetes or your insulin resistance, that can slightly increase your blood sugar levels to be slightly falsely elevated. You might see a slightly increase in liver enzymes, but for the most part, if you have a healthy liver, it's not going to be abnormal. But again, so those would be, I would say, the ones that might be the most concerning. But if you're doing 8 to 12 hours, you should be fine.
Okay.
What I would do is just repeat that and eat more like a regular non-processed whole plant food diet or meal that day. So beans and a whole grain and lots of, non-starchy veggies. That'll give you a better indicator.
Okay, I think there's a question from the chat box. Dr. Marbas, how do you deal with a primary care doc who doesn't really, I guess, doesn't really want to recommend all of the lab tests? And, how do you go about convincing him that some of these things, like an omega fatty acid test, they will say that that isn't needed, but how do you move forward with that beyond, maybe getting a new primary care doc?
So unfortunately, it will depend on a few things. One, how well versed your doc is in a plant-based diet and understand the utility of what to do with these. So the reason there might be some hesitancy for physicians to order any labs is one, they don't understand them, or two, they don't know what to do with them if they're abnormal, right? And so they're like, I only order tests because maybe they're looking to change them. That's how I typically will look at labs. One is I'm only going to order what I know that it's going to be actionable and, to get a good assessment of, let's say, someone who is eating a plant-based diet, at least a baseline assessment. So if someone is not wanting to order that, depending on where you live, you can actually order your own test. Some states do not allow that. I don't believe New York does. And then you can see people like myself, right? And, Love Life is also another good place. It's resold plant-based telehealth to John Mackey, who started Whole Foods, is now Love Life. So there's some amazing physicians there. They are also licensed. They see people telemedicine-wise. And you can get those labs ordered by or someone else. There's also functional lab tests that a lot of places are offering. So you can always look for other things, but many times you don't need more than these labs. And if you're taking a supplement of an algae omega-3, you probably don't even need to do the mega check. Most people will do okay just with taking the supplement if you want to do that.
Thank you.
Okay, I think the next question is from me. If your basic lipid panel is all good, is it necessary to ask to check LPA and ApoB still?
I would. Because remember, the LP little a is that independent risk factor, especially if your LDL had been higher than 100 for the majority, and then you went plant-based and now it's lower. I think that ApoB is really important because it tells you how many of those small little difficult little LDL particles can be causing damage. So LDL will have different sizes. Big fluffy LDL doesn't cause as much damage as this sneaky little LDL with the ApoB on them. ApoB is also on LP little a. And if you talk to a lipidologist, meaning someone who specializes in cholesterol management, I almost went down that path, but then I got distracted by other things like running a business. But there's some they will tell you that ApoB is really, really important because it's kind of an overall indicator of the dangerous particles in your blood. So yes, and the LP little a will maybe take a little bit of relief. Maybe you don't have to be as stringent as far as your LDL and where your ApoB needs to be. So, but the HSCRP, the inflammation, and the cholesterol work together to cause heart disease. So don't forget that either.
Can I eat nuts, seeds, and avocado if I have a calcium score of 62 and high blood pressure, but no other issues?
Yeah, I have no problem with people eating, a handful of nuts and seeds, a little bit of avocado, because again, these are healthy, important fats. Your body requires three macronutrients, right? The carbohydrates, your protein, and your healthy fats. And so just when you eat that little bit, you're going to fall into a naturally pretty low fat diet anyway. But I will share with you, when I first went plant-based, I followed again, certain recommendations, cut out all nuts and seeds, got really super low fat. I actually got really depressed and didn't feel well. And so as I started thinking and looking into things, that's really where I was like, I need to start bringing some other things. And when I did, I feel so much better. It was just not my natural state of affairs to be low energy and depressed. So things got much better after that.
Dr. Marbas, I'm going to jump in to ask a question because number one, I want to point out your book, and Linda's going to put the link to where you can get the book if you want it. She mentioned that at the beginning, and
thank you.
It's a really interesting book. It's got pretty much any question. In fact, I thought I'm not a beginner, but if I'm talking to a beginner, this is where I'm going to go look to get the answer.
Great. Yeah.
And Julie has asked another question. She's got the new book too. And she said, she's stumped about sources of calcium. She says your book lists fortified plant milks as the #1 source. But if I try to get soy milk with nothing but soy and water, then I'm really not getting the calcium, right?
Typically these are fortified, right? So your almond milk may have a little bit more, but the fortified plant milks do have it. So when I'm trying to get people to consume more, I'd rather than look for the fortified. If they're more concerned about, additives and things, I appreciate that. So that's where I would say do something like the tofu or other food sources, like the calcium set tofu, because you'll have more likely to even get more than you'd probably get from the fortified plant. But again, you have kale, bok choy, the collard greens, all the Esselstyn. That's your, just a dream of, think about Archer Esselstyn's in his songs of the greens. You're going to get lots there too. So that would be the easiest way is the fortified plant milks. But if you're hesitant to do that, I would, move towards maybe tofu, at least a serving a day or so, and then those dark green leafies as well. And there's some nuts and seeds that have high calcium too. You do need to be careful about taking calcium supplementation. But however, when you're mixing this with food and it's low amounts and the way it's absorbed, it's slowly absorbed. The problem is when you take high doses of calcium supplements, it enters into the bloodstream very rapidly and can cause issues like blood clotting issues and stuff, hence increasing calcification, different things. So you can do other food sources. Those are just the highest ones available. Again, this is not a be-all, end-all book. It's just starting the conversation and understanding to help you guide you down the right path, like which road do I go? And this kind of leads you in that direction.
Along those lines, would soy impact your cholesterol if you're going in for a lab and you've been eating a lot of soy? Does that impact your lab?
It should help. It should lower it.
Help. Okay.
Yeah, absolutely.
Thank you.
I do recommend 2 soy servings daily.
And my husband has a disease called AL amyloidosis. I think I pronounced that right. And a recent blood test shows a high C-reactive protein. Can you explain what that might be indicating?
Well, okay. So first of all, is it high CRP or did she say high HSCRP?
And she did not say HS. She just said high C-reactive.
Okay, so there's CRP, which is a marker of inflammation, right? So certain conditions like the amyloidosis and there's other types are driven by that chronic inflammation, right? So autoimmune disease, things like that. But yeah, amyloidosis is prolonged inflammation, and it's not uncommon that you will see that. So it's related to the autoimmune disease process in and of itself. And so that's when you'll see it, like rheumatoid arthritis, lupus, MS, those things. You'll also see elevated CRP levels.
We have another question about LDL. It says, I eat a whole food plant-based diet with no added oil, but cannot get my LDL under 100. What would you suggest?
There's a few things. So I do believe I have on my website, I think if you join we have a free community. It's a free school community, and I have like my cholesterol lowering protocol. You could start there and just look at a few things, but it talks about, healthy nuts and seeds, the soy products, making sure that you're eating a lot of those soluble fiber rich foods. Because what's happening here is to understand that when you eat food, your liver makes cholesterol, right? Because it's important for the cell walls, because we're not rigid cells. We need flexible cells. And so that is an important piece there. So that's one thing to make sure, because when you eat, your liver releases the LDL to grab hold of different things and pull back in for absorption. What we want to do is that soluble fiber grabs the cholesterol and it escorts it out the back end. So that would be one thing, is increasing thing. And then pay attention to your triglycerides. If your triglycerides are above 100, pay attention to things that you might be, if you're adding any other types of like dried fruits or dates on a regular basis, or any alcohol. Elevated triglycerides can also cause through a system, you may see a higher level of LDL. So just again, some things to pay attention to. If you're insulin resistant, things like that. Again, this is where it's important to get the whole picture.
Okay, this one, this lady asked, why would you repeat lipoprotein, and I'm only assuming that's Lp(a), a test every year?
You don't necessarily need to repeat every year. Just once should be probably sufficient for sure. Unless we're looking to, if there's some medication that they put you on that it comes down the pipeline, that would probably be an indication. But yeah, probably once would be sufficient. You may see it might fluctuate a little bit, but once you know that you have high Lp(a), you just assume that you do have it.
Okay, and just as a reminder, high would start at 75, or where
typically 75. Yeah.
Okay.
But there's some people you'll measure, like myself, it's undetectable. There's only around 20% of the population is going to have an elevated Lp(a). So you just need to know if you're one of those people.
Okay.
This question comes from the chat box as well. And this person eats a whole food plant-based diet with no added oil, but can't seem to get their LDL cholesterol below 100. Any suggestions? We may have kind of touched on some of this, but
yeah, it's same that I mentioned a while ago. I think that's the same question. But the cholesterol lowering protocol, you could, again, amla powder. It's a great thing. It's basically Indian gooseberry dried up. You can get that off Amazon. Like a half a teaspoon a day does some really cool things with your cholesterol, increasing your soy, nuts, products. One Brazil nut a week is really helpful for some into people. Bergamot can also be very helpful. It's also found in Earl Grey tea. If you like tea, I don't drink coffee, but I drink tea. Yeah, so there's several different things you can do. Berberine supplements also are tremendous, powerful, actually quite powerful at lowering that. I would not do supplements outside of that, just because you want to be careful. Those are some safety things.
So Dr. Marbas, we do thank you for doing this presentation. And I know you haven't received it yet, but you have a wonderful lavender package that's going to be delivered to you. As you know, lavender is for stress management. And I'm sure that going back to South Dakota in this cold weather is going to be very stressful for you.
I don't go back to South Dakota. We're in California. We're gonna be hanging out here. Plus my first grandbaby's on its way. So
Oh,
I'll be
okay.
hanging out here for a while.
Well, if you're in the LA area, you may be getting stressed. So,
We're down by San Diego, so we're okay. Yeah. Thank
okay.
you though.
Well,
I'm looking forward to it. Thank you so much.
yes, but we certainly do appreciate you. Dr. Marbas, we just truly thank you for spending all of this time with us. This was so informative. Your booklet is excellent. And I think this is going to help propel us to our next level. So thank you
Oh,
so much.
great. You're welcome. I hope you guys have a beautiful rest of your day.
You too.
We go ahead and
Great
look at our next events now, Dr. Marvis. So you're welcome to stay, or you're welcome to go ahead and leave, because we know you do have a busy schedule. Thank you so much.
No, thank you. Yeah, we have to actually get out of here by 11 because we're moving on to the next place. So, but yeah, thank you so much. Appreciate y'all.
Okay.
Bye.
Okay, so
Bye.
let's look at our next events, and we've got several coming up. First of all, don't forget, you should have received an email with Dr. Marb with a link to the actual handout that goes with this. And if you didn't get it, catch that with the QR code with your camera. And Linda is going to post in the chat the link so that if you want to get there and look at it again after we've heard her excellent cost talk, you're welcome to. As Debbie said, it will be up on our Chat and Chew More Plants YouTube channel. And when you go to the channel by clicking on that QR code or using the link in the chat, be sure and subscribe, and that way you'll be notified as soon as it's put up. We want you to know that on the YouTube channel, there are lots of things like, for example, we have healthimonials. Vicki interviewed Brittany, who helped write the book that Dr. Marbas was just talking about. We have cooking videos, expert speakers, traveling healthy, and question and answers from those speakers. So take a look at those when you're there. And this one specifically, we want you to know that we have changed it a little bit. This was the in-person meeting that we had with Jane Esselstyn the 1st of January in Lakeland, Florida. And it was a long video and people have been enjoying it. But if you want to go back and look at parts of her presentation, like how did she make that chocolate pudding? Because that was the most heavenly dessert I've ever eaten. You can find like what they call a timestamp if you look in the show more section of that video, and you can watch just that section. Or if you want to know what is it that causes diabetes, in fact, she's doing that in that photograph. She has a neat way to teach you these concepts because she taught middle school, or she teaches it. So that's there now on our YouTube video for Jane Esselstyn. Now we've got one event coming out also in February. Debbie, can you tell about what that's going to be?
Yes, well, everybody knows it's Heart Month, and as a Food for Life instructor, I will be teaching a nutrition and cooking class specifically on heart disease and everything that goes along with it. But I will also be having a special guest. Some of you have seen him before, Dr. Akil Tehar. He is known as the Heart Doctor. He is going to be presenting and telling a little bit about his story, but his presentation is why heart disease is the #1 killer of men and women in the United States and globally. So I hope everybody will sign up for that. It is a free class. We're going to make it fun and exciting, and be there or be square, by golly. Okay, thanks, Kathy.
And don't forget, there's the QR code to register for that class, or you can get it from the chat box that Linda's posting. For March, has anybody looked like that woman on the left after a night of restless turning and tossing and turning? Raise your hand if you have. I can't see you, but I'm sure there's lots of hands up. Anyway, Dr. Veress is going to do a session on why can't I sleep? And to register for that, you just go to that QR code or go to the link that's in the chat box. It should be a really good one. A lot of research in this area can maybe help each of us find a restful night. And then in mark your calendar, April the 11th, we'll have to have Dr. Ron Wise. And if you've seen Chef AJ's YouTube, you've probably seen him. He's probably the best one to ever ask answer questions when people ask questions during the time with Chef AJ. So he's going to come do it for us. So mark your calendars for April 11th. And this is our calendar on the right for the 24-25 year. Those videos are up already, except for the last 3 speakers. And you can take a look at those, what's planned ahead, to be sure they're on your calendar using the QR code. The other way you can keep up with what's happening is our newsletter, and you can see the email up there. You're welcome to send an email to ask to be added to our monthly newsletter, and you'll get all of these dates delivered to your mailbox. And don't forget, we have a podcast. That's the link. That's the QR code for that. We have a new one up this month where we've integrated in some information from Dr. Goldhammer's Zoom last month with our newest healthmonial with Cindy. So that is a really good listen. It's fairly short too.